Good afternoon. I'm David Sweat, Deputy Director, Shelby County Health Department. Welcome to the City of Memphis and Shelby County Joint COVID Task Force press briefing for June the 3rd. Starting right now with the numbers, if we can go ahead and pull those up. Okay, so here in Shelby County, we've had 98,829 cases reported so far, including 50 cases new yesterday, 7,440 cases from Tipton County in Tennessee, 5,158 cases out of Fayette County, Tennessee, 22,144 cases in DeSoto County, Mississippi, and 5,762 cases from Crittenden County in Arkansas. We have had 1,677 people who have died from COVID during the pandemic, and our current test positivity rate is 4.7%, and our reproductive rate of the virus now is at 0.8. And if we could now turn to looking at the vaccination progress, if we could pull the other map up and we can see that progress. So right now, as of a couple days ago, yesterday, we were at 360,216 people who have been vaccinated. Now they have received a total of 624,770 doses of vaccine because, of course, to be fully vaccinated with the 2-dose series, you have to have 2 shots. We have 84,363 people who have started a 2-dose series and are partway through. We've averaged about 1,068 people per day getting vaccinated over the last 7 days, and our rolling 7-day average for case count is 52 cases a day for the past 7-day period. In terms of our progress, we are 51.5% of the way toward our vaccine goal, which is 70% of Shelby County residents or 700,000 people being vaccinated. But if you look on the state's websites, they're not going to be reporting our progress against the vaccine target goal. They're going to be reporting the percentage of the population that's been vaccinated. So right now, 38.4% of Shelby County residents have been vaccinated, but that 38.4% of the population is 51.5% of our target goal of 700,000 people. So for more information about the progress we're making on the vaccine campaign, I'm going to invite Doug McGowen to the podium.
Thank you, David. And I appreciate the update. Good news on the reproductive rate as well as the positivity rate. So David told you that we're nearly 630,000 vaccines in, almost 364,000 people and there are almost 280,000 people that are fully vaccinated, and that's what David mentioned. That's almost 30% of the population. So we are making some progress. We will continue to offer vaccinations through our public vaccination sites as well as through our private partners. There are fewer public vaccination sites available today. As you know, we're still vaccinating at the Pipkin building in Germantown and in Whitehaven. The Germantown and Whitehaven locations will likely come to a close at the end of this month. So Germantown on the 24th of June and the Whitehaven facility will close down on the 30th of June. And that's all based on demand that we're seeing and that we're forecasting. Certainly, should there be a massive uptick, we will reevaluate, but likely moving into July, we will just have the Pipkin as the prime public drive-through access point. What we will do is maintain our ability to do community-based pods, which have never ceased. We will continue to vaccinate in conjunction with our partners at churches and businesses and schools. We have also continued our homebound and homeless vaccinations, and that program has been working wonderfully well. Almost 1,100 people who are homebound have been vaccinated through the program. And if you know someone who is homebound and needs a vaccine, or if you yourself is homebound and you have not yet received a vaccine, we would ask that you go to the covid19.memphistn.gov website and schedule your appointment right away. We're trying to accept as many appointments as we can in June for that first vaccine so that we can get back to you in 3 to 4 weeks' time in July. If you don't have access to the internet, you can call 222-SHOT, S-H-O-T, and let them know that you are homebound and need a vaccine. And the healthcare navigators from the Memphis Fire Department will be more than happy to come to your home and provide that vaccine. Also, our partners at Maritan and some of our private doctors are also making those home visits, and we'll make sure that you're taken care of. In order to get the word out to people about vaccine opportunities, we are going door to door. As you know, Mayor Harris has put together a team of community partners to get the word out. The city of Memphis has added to that with our Best Shot field operators. They are out, as I mentioned last week, in zip codes 38106 and 38126. So far, they've knocked on more than 2,000 doors and had face-to-face conversations with people about whether they have been vaccinated, what their hesitancy might be, and sharing with them the importance of getting vaccinated. And so we're excited about that. We're also excited that we have a street team that's going to businesses and places where people gather to encourage people to share information with their patrons and also to see if people are willing to participate in a vaccination program. Now, we had an incentive to get people vaccinated. As you all know, we had a sweepstakes, our Best Shot. That sweepstakes has ended. We have selected a winner, but we will not be announcing that winner for probably the next week or two. The reason we're not going to announce is because per the rules of the contest, the winner has several weeks to come forward and to validate the fact that they were in fact vaccinated as well as a resident of Shelby County. And so since they have that 14 days to respond, it could be any time between now and 14 days from now when that person comes forward with their validation. So it is exciting. We are confident that that really did improve the demand for vaccines here locally. As evidence, while I don't have empirical evidence, many of the other cities that had a community vaccination site that was staffed by FEMA and DOD saw a dramatic drop-off in their demand. We did not see that drop-off nearly as dramatically as the other communities did. In fact, some of them went down as low as under 100 a day, while we stayed right up at about 1,000. And so nothing else was different besides the fact that we had the campaign in place. So we're very thankful for our partners who helped to make this sweepstakes possible, and we'll be excited to announce the winner in just a few weeks' time. Last thing I'll mention today is if you're not homebound, if you're not able to drive, but you need a ride to get a vaccine, we are very thankful for the partnership through 901 Ride Choice. If you would like a ride to a vaccine location of your choosing, you just dial 901 Ride 901. Or you can go to the 901ridechoice.com website and schedule your ride to get a vaccine. They will come and pick you up, they will wait for you to get a vaccine, and they will drop you back off at home, all at no charge to you. So I encourage you to take advantage of that opportunity if you need a ride to vaccine. So with that, I'll stop and I'll take any questions that people may have.
Kelly Roberts, WMC.
Hey, sorry, I couldn't hear. I think you said Kelly Roberts, right?
Yes, I did.
Okay. So, sorry, the audio's different today. So my first question, though, is about vaccines during the month of June. The CDC director was on the Today Show today talking about the big push for vaccines kind of nationwide this month, knowing that President Biden does have that July 4th kind of deadline where he'd like to see 70% of the country vaccinated. Anything planned for this month kind of push-wise to get more shots in arms?
Sure, it's a good question, Kelly, and that's what we mentioned, that street team that's out there, asking businesses and their patrons and providing information, so they're going door to door, trying to get people to help us get the word out, and then our street team that is actually in the neighborhoods. And one thing I failed to mention is that in addition to 38106 and 38126, we have a team of Spanish-speaking Spanish-speaking team members who will be out in the neighborhoods where we know there are people where English might be a second language, and they'll be going door to door in those neighborhoods, giving people information about that. Additionally, we have lots of capacity at our Germantown location, at our Whitehaven location, and at Pipkin. I wish people would take advantage of that. And we also have 2 vaccine machines. Those are our mobile vaccine machines where we can go to 2 separate sites, community-based pods, to push those vaccines out. We'll be active as many days as there are there are agencies that want to partner with us. We have a list of those that we'll be doing. And then I'd also encourage people, because there is a lot of capacity at our local pharmacies and doctors' offices. There is way more capacity than there is demand, so I have no doubt that should people get out to get vaccinated this month, as the president has been pushing, that we have the capacity here to meet that demand. So I encourage everybody to take advantage of that. And should we need more capacity, we will add it.
Thank you. And speaking of that street team, how invaluable, or, I guess, what kind of information have you found out from them? I've been talking to them a little bit, and it seems like they're finding out some really interesting stuff that will help them kind of pivot the way that they're doing things. For example, they've found even in those low uptake of zip codes that it really is kind of a young person thing there too, that all of the, people over 50 they find really have gotten this vaccine. The information that they're bringing back, how valuable is that?
It's incredibly valuable, and I appreciate you asking that question, because there's nothing like one-on-one communication with a person to really find out what they're feeling, what their attitudes are, and what they believe could be helpful. So that is one of the initial findings. We don't have quite enough data to have a scientific evidence-based conclusion, but you're right. We are hearing that many of the folks who are 50 and over, and as David has shared with you, well more than 70% of the people who are over the age of 60 in this community have had a vaccination. So we're running into that. The message here is for young people. We haven't talked about it in a while, but the vast majority of people who are sick and in the hospital are people that are young, under the age of 40. The vast majority of people who are very ill and in the ICU is trending towards the younger population. They're getting sicker and they're staying in the hospital longer. So this really is about young people and getting young people to come out and get their vaccination. So it's a great question. Our team is doing a lot of canvassing, and they're bringing information back that we think will be helpful to get vaccines where and when we think we need to do that.
If there are any other questions from the media, please raise your hand. Okay, I don't see any other questions today, so I'll send it back for any closing messages.
Okay. David, anything you want to wrap up with? Because I'll just... Okay, so I'll give a couple of words, then I'll turn it over to David. Again, this is our opportunity. I know that the numbers are looking encouraging. I would ask that during the month of June and July, I really need about another 30,000 to 40,000 people to come out and get vaccinated just in that month to really get our numbers up. David will talk about the immunity that we have, where we have a significant percentage. We're nearly at 40% of the people have been vaccinated here. Combined with people that have some immunity from the disease, we are very close to that 70% immunity. But that still means that almost 1 in every 3 people in our community is susceptible. So let's bring that number down. Anyone who's hesitant, talk to somebody who's already received the vaccine. We have a lot of it available. We have tons of Pfizer available. We have lots of J&J available if you prefer the one shot. Come on out and get vaccinated so that we can all have a safe summer and enjoy a wonderful, vibrant fall here in Memphis, Tennessee. So David, I'll turn it over to you for anything you might have.
So just want to emphasize a couple of points that Doug made, and also make a pitch, I guess, to our younger folks. Right now, in the last 14 days, more than half of the cases that have been diagnosed in people less than 35 years old. In fact, 24% of the cases diagnosed in the last 2 weeks have been children less than 18 years of age. When we look at the proportion of the population that more than 50% of the people in the age group are vaccinated, that begins at age 45. So people 45 years and older only represented 31% of cases in the last month. But people 44 years of age and younger represented 68% of all the cases that occurred in our community in the last 30 days. So everything is moving toward the younger population. And the things that you may have heard people say on social media or in the media on TV, over the last year, a lot of the talking points that various pundits had was, well, it's not that big a deal if you get sick if you're young. It's not going to kill you. That's not entirely true. But what is being left out of that, those talking points that some people have argued over the past 15 months, that illnesses in younger people are not something to be concerned about, doesn't really take into account all of the impacts, the negative impacts on your life that having a long-haul COVID infection and fight against COVID disease can take on you financially, mentally, psychologically, and physically. Because it's true that younger people with a strong immune system are more likely to survive COVID infection. That is true. But they may still develop long-haul COVID and have illness effects that last for months. The virus still does tremendous damage to the lungs, scarring the lungs, and leaving you more susceptible to other kinds of diseases later that may follow. It's financially ruinous to wind up in the hospital for weeks at a time in an intensive care unit. So there are a lot of reasons besides the fear of death to get a vaccine. The vaccine can stop you from having severe illness. The vaccine can stop you from having to wind up in the hospital. It can also mean that if you are out and about and you do get exposed, you don't have to quarantine. You've been vaccinated. You don't have to stay home. You can go to work. You can be about the world doing your business, even if you get exposed, if you're fully vaccinated. So there's a lot of reasons why our younger people should consider coming out and getting vaccinated. It's about more than just preventing death among older individuals. The vaccine is excellent at that, but it's also about preserving your freedom and life and freedom to enjoy life for the rest of your life as a young person, to go ahead and get vaccinated and avoid all the hassles and potential pitfalls of COVID infection. So we'd encourage you, please take advantage of the opportunity. It's freely available, widely available. And if you need help finding a place to get vaccinated, just go to the City of Memphis website and they can show you all the options that we have available for you today. With that, I'd say thank you to everybody that has been vaccinated, and thank you to everyone who has helped us through this effort through social distancing, wearing masks, and all the other things we've asked you to do. You've made a huge difference in this pandemic here in Shelby County. Have a good week.
Thanks, everyone. We'll be back here next week.